Sick Kids Hospital is dealing with extremely high patient volumes and is warning about long wait times as well. Christina Tinali joins us now live with more on the story. Christina.
Yeah, so George, I spoke to the head, at least one of the heads of the emergency department at Sick Kids, who says this is virus season. So they do generally anticipate an uptick in cases, but what they're finding is an increase in the number of patients coming to their emergency rooms. And they believe one of the factors, aside from it being virus season, is that people are having a hard time getting in touch with their primary care providers. And it's something we've reported on, the shortage of family doctors here in the province, particularly throughout the pandemic. I want to bring in Dr. Dina Kulik, a pediatrician and the founder of Kid Crew Medical. Dr. Kulik, thank you so much for joining us. I wanted to ask you, what are you finding? I mean, are you hearing from new patients saying, please help me, I can't reach my primary care provider, pediatrician, or I'm having a hard time finding a doctor?
Absolutely. So I concur that viral season is definitely upon us. It has been very, very busy at Kid Crew where I work for the last number of weeks. We are deep in viral season. Kids are not masked and many kids are in school in close contact settings, and it's leading to a lot of spread of viruses. So our volumes are very high here. And yes, we do hear from many, many families that they are having challenges accessing their primary care physician, and they're reaching out to us as well to, have us provide an opinion as well.
And Dr. Kulik, when you say an increase in viruses, we know it's flu season. We know the province's chief medical officer of health acknowledged that there would be an uptick in respiratory illness, flu and COVID-19 as people make their way indoors. But what viruses aside from that are you seeing? Are you just seeing kids coming in with coughs and colds?
Yeah, it's the whole gamut. So tons of pink eye, tons of viral rashes, runny nose, cough, sore throat, stomach flus. It's really all the viral symptoms you can see we're seeing in kids right now.
And what is your advice to parents? I mean, Sick Kids says on their website, they have a resource, so I should point out they put this on Twitter, to check to see if the needs of your child require you as a parent to bring them to the emergency room, or if you could pursue other options. What do you say to parents who say, my child's not feeling well, cough and cold? Is that go to the pharmacy and get medication, or is that bring them in?
I think if a family is worried, it is wise to touch base with their primary care provider. Hopefully those people are accessible to families. Unless a child is having difficulty breathing, difficulty with keeping anything down in terms of drinking, losing consciousness, unless they're having really significant emergency-worthy symptoms, we do want to avoid kids using the Emerge unnecessarily. That's where, touching base with someone's primary care doctor or going to a walk-in, which there's many in the city and across the province, that is your best bet. If your child's had very mild symptoms, runny nose or mild cough or a very recent fever or mild diarrhea, those things can be managed at home. Typically, we're not giving medications for those viral symptoms. More symptomatic care, like using a humidifier and taking over-the-counter medications if they're accessible for fevers, or using a saline spray or a suction, or these kinds of symptomatic management versus giving things like antibiotics. The vast majority of these illnesses do not require intervention, including not requiring antibiotics or imaging.
And Dr. Kulik, I only have a few seconds left here, so I want to ask you really quickly, in terms of an increase in numbers and calls to your office, what are you seeing now in this still COVID-19 environment and with a shortage of family doctors compared to, let's say, 2019, autumn 2019?
Oh, our numbers have risen quite a bit. So we've seen, 100 to 200% more patients each and every year. It's hard to say whether that's because kids are more sick or kids have less access or brand awareness for us, but yeah, it's definitely a very high number of sick patients recently contacting our office.
Okay, pediatrician Dr. Dina Kulik, we always appreciate it. Thank you so much for your time.
You're welcome.